healthcare industry, which is currently $65 billion, is expected to reach approximately $100 billion by 2015. To give you a perspective about where the opportunities lie, if you look at the Indian healthcare industry itself, India, as you know, requires many doctors, many more beds, many more nurses. So the investment, as you can all imagine, is going to be very, very considerable. When you take the healthcare industry itself, we can all see it's massive. A part of that is, of course, the IT industry itself, which is what we are interested in. The IT section of the healthcare industry is expected to be approximately $250 million. But the good news is that it is one of the fastest growing market, and it is expected to grow approximately 22% every year. So based on all the statistics given and all the information that we have, it is very clear that this is one industry that offers what I would call a good target market because of the size and because of the growth and because of the importance of the industry itself. So where is all the money going when it comes to the IT sector itself in the healthcare industry? Most of the investments, as we can understand, will go towards patient care. The healthcare industry itself, the number one important item in the healthcare industry would be the patient. So obviously the patient would receive most of the money that is invested in the industry. So the money goes into purchasing equipment, diagnosis and curing patients. And of course, we have heard a lot during the last couple of days about telemedicine, video conferencing and related items to help in the diagnosis of patients remotely. One of the other aspects of the IT healthcare industry is picture archiving and communication PACS, which is a technology used for, say, X-rays, for scanning them, digitizing them, and storing them. Another aspect of the IT healthcare industry would be the HIS systems, healthcare information systems, which has also received a lot of importance or attention during the last couple of days. And of course, anything that can improve the patient care, the response times, the speed with which we can respond to patients' needs, inquiries, etc., would also be something that we need to focus our energies on. In addition to these things, surprisingly what we find when we look at the IT sector of the healthcare industry itself is that a lot of the hospitals and institutions tend to spend a lot of money or invest a lot of money in equipment which will raise the profile of the institution in the marketplace in terms of being able to market themselves to the public at large. What does this mean? Go for the latest, go for the most sophisticated equipment that money can buy. So taking all these things into consideration, when we talk about return on investment, the goal, of course, is to make sure that when we make an investment into the IT sector of the healthcare industry, that we get a positive return on investment, meaning that if we invest some money into it, we should be able to get more out of it. That's a no-brainer. So in order to achieve a positive return on investment, we have to make sure that in terms of the equipment investments or capital investment that we make, the money that the institution can get out of the investment that they make will provide a greater return than the money that they have invested in. In doing so, you have to make sure that the equipment that you purchase, because of the capital nature of these investments, is well spent. Many times the new equipment may not be compatible with the older equipment, which means that you have two types of equipment. The older one, which is not compatible, which means you will have to go through extra training and effort. in order to bring up the people and train them up in them being able to use the newer equipment. So the current method whereby going for new equipment for the sake of having the latest or the greatest may not be exactly viable. The danger also is that patients who many times get attracted to institutions which claim to have the best equipment tend to also switch. So in trying to go for equipment, we remember there are other institutions which may also play the same game, so that in making the investment, you may turn out to be your loser. So what is the need of the hour? In terms of, as I said, in terms of making the investment, we have to be careful how the money is spent, because as you know, institutions demand that any investment made provide them with adequate returns. So when investments are made many times, the investments are not really investments in the sense of the word, because they tend to become expenses. They don't provide the returns because in making the investment, money is spent unnecessarily on items that don't provide continuous revenues. For example, we could be investing in automated equipments for collecting information, but if they have to be manually collated and then manually sorted, then the fact that it was automatically collected doesn't make much of a sense. So it's very important to make sure that in acquiring equipment that they all work well together, that we avoid what is commonly called fragmentation in the industry itself. The other thing is, in going for some of the latest and greatest equipment, we have to avoid going for the latest in technology, because technology in itself can cause disruptions. You have to train the people, you have to probably have support equipment, and you make the systems that are used in the Western countries may not often be used here effectively because of problems with infrastructure and the lack of execution or implementation speeds here in this country. So our recommendation is that in terms of being able to improve the return on investment, that we go for what I would call the low-hanging fruits. Look at what we have. Make sure that you're able to improve the efficiency of a lot of the processes and systems that is available in the healthcare industry itself. So what is to be done? Avoid fragmentation, improve asset utilization. When you invest in new technologies and equipment, make sure that they are compatible and automate the workflow. So in summary, the recommendation that we have is, instead of going for sophisticated equipment, go after the low-hanging fruit. Try and make sure that what you have is properly utilized. Go for software that will help you to assess that the equipment that you have is properly used, and make sure that the equipment that you get is all compatible and work well together. Thank you.
I'd like to share the background of this study. My profession, I am a physiotherapist, and I mainly deal with the person with disability and old age persons. And during I deal with my patients, I feel there is a large information gap between the end users and the healthcare providers. And all time it is not possible by me to provide all the information and counseling which guide me to start a healthcare helpline, that is the Hello Physio helpline. But later stage, I feel that the physio helpline is not sufficient enough to provide the information, because this special category of peoples like geriatric peoples and disability peoples need some social and psychological and also the healthcare issues and other related counseling and the informations. So that I start the Hello to Able 24/7, that to provide provide healthcare information, social help, legal information to these special needy people like disability, old age, and the children's, the guardians or the family members of the children with differential need. But it is very difficult to sustain this type of helpline without any funding, but to make it self-sustainable, which keenly generate an interest inside me that how this type of helplines runs in India. So that after join in Indian Institute of Health Management Research as a MBA student of health management, I start some small study. What is the current scenario of healthcare helplines and how these helplines are run in India, whether they are self-sustainable, whether they are fund, and what are the various classification. But after start my study, I found some of the very interesting facts about the healthcare helplines in India. The objective of my presentation is to define what is healthcare helpline, what is healthcare call center, what is healthcare customer care or help desk. The evolution of the healthcare helpline or call centers in India, the classification of healthcare helpline or call centers, Indian scenario of healthcare helpline or call centers and its global comparison, challenges and opportunities, both public and business interest, and home takeaway messages. The definition of healthcare helpline, healthcare call center, help desk or customer care is no standard definition available still yet. Some existing explanation in various type of literatures are for the help desk or customer care related to healthcare issues. These are the services oriented face-to-face customer and provider interface may or may not be supported by telecommunications. The healthcare helpline, so-called healthcare helpline, dedicated telephonic communication for providing healthcare information, education, guidance to common people, including customer-related services provided by any organization. No number of callers are few in number. The healthcare call centers, a central unit aims to provide healthcare information related to public health importance or for healthcare business context, including healthcare knowledge and business outsourcing, usually meant for handling multi-task healthcare information activities of a large network or different organizations. The suitable explanation, what I like this explanation from one literature that the healthcare helpline, call centers, customer care centers are different terminologies but interchangeable by nature, used for a mode of communication, maybe in the field of public health or corporate healthcare sector, bridge between the information or service seeker and the service provider using information communication technology. It may or may not be integrated with outreach healthcare services of different nature. The healthcare business, outsourcing, knowledge processing, public healthcare related activities are included. It may be specialized healthcare call centers or a part of multi-task oriented call center. The evolution of healthcare call centers, what I found from various literature are healthcare help desks face-to-face. Initially, all the health communications, all the healthcare informations are solved by the face-to-face counseling or information providing basis. Later stage, it is modified to the telecommunication support without database. Direct telecommunication without no database they are utilizing, and sometimes with some pre-structured database, those are handwritten, but no computerized database are used initial stage. Later, the telecommunication as a single interface of communication is actually comes into the scenario, which is used largely in the public health and social sector, and as a way of develop customer relationship